Malaria is still a significant public health challenge in Kenya, with the biggest impact felt in regions characterized by high temperatures and places with higher rainfall. According to Dr. Payo Opankule, there is a need for the Kenyan population to take preventive measures, especially during the rainy season, to control mosquitoes.
One of the key things to do is essentially spraying insecticide, especially in mosquito breeding zones. And usually one of the reasons why the rainy season can be a problem is that the rain creates a lot of small puddles in different areas, and that's perfect ground or territory for the mosquitoes to breed. So if we can essentially fumigate areas where there are small mosquito breeding grounds, that usually helps. Then insecticide sprays in the house also do a good job of preventing mosquitoes from biting people.
Dr. Payo has also highlighted symptoms to look out for, such as having a fever, and seek medical attention, especially those who have traveled from malaria-prone areas.
Then some of the other symptoms that point us towards malaria can include things like some mild abdominal pains, muscle aches, joint aches, fatigue, some minor chest pains. All of these point us towards malaria. It can be very non-specific symptoms, but the key thing is if a patient tells us they've recently traveled to an area that's endemic with malaria.
Persons who are infected with malaria are also advised to seek treatment, since if a mosquito bites an infected person, then it can transmit the virus to another person, among other issues that arise when one is not treated.
In certain more serious cases, malaria can then go ahead to affect the brain, it can affect the kidneys, it can cause very low blood sugar, a huge host of very serious complications, which is why early diagnosis and prompt treatment is incredibly important.
To this end, Kenyans have been urged to take precaution by taking anti-malarial drugs to ensure that they prevent themselves from the deadly disease.
If you take certain anti-malarial drugs before you travel, and then when you travel to wherever it is that is endemic, and then for a certain duration after traveling, or when you've arrived back home, that's one way in which you can prevent malaria. I won't go into the details about the drugs specifically, because we're very particular about which drugs we give to who. Yes, because the drugs we'd use for children would be different for pregnant women, which would be different than just for normal adults.
Robbie Omondi, K24.